Hi, Southwest Florida. I'm weekend anchor Shari Armstrong with a reminder that it's okay to talk. I know for many men, sharing about your health isn't something you're too interested in. But this month, as we focus on prostate cancer awareness, I'm hearing from more and more men who tell me that not sharing, not talking about what's going on with your body, even with your physician, could impact you and the people that you love.
This Florida dad, who like many of you loves family and fishing, says he gets why you might steer clear of a cancer screening.
First thing comes to your mind is you're going to die.
Barney Morris knows that thought firsthand. A routine medical exam for work revealed an elevated PSA, prostate-specific antigen. And soon after, at just the age of 41, a diagnosis.
Came in and said, Barney, your test came back and you have cancer, and we have to take out your prostate. And the journey started.
Surgery followed, and months later, a reoccurrence, which required radiation. But 15 years to the month, Barney's remained nearly undetectable. So naturally, we had to celebrate during the interview. Now he says it's about the journey of other men like him. And here's why. The Prostate Cancer Foundation says 1 in 6 African-American men will be diagnosed with prostate cancer. African-American men are nearly 80% more likely to be diagnosed with prostate cancer than white men, and Black men are more than twice as likely to die from the disease. Experts say the reason for this could be a combination of genetic differences, lifestyle, access to medical care, and nutrition habits. Dr. Kosje Yamoa is a physician scientist at Moffitt Cancer Center in Tampa, who says all of these factors matter, especially that last one.
The whole healthy lifestyle is huge because what you put in your body is able to allow your system to accommodate a healthy environment to fight disease.
And Dr. Yamoa and Barney both tell me that the fight to lower this disease's rate amongst Black men also requires a cultural shift for some.
We just don't talk about it.
Black men particularly do not like talking about their health issues.
That statement, Black men don't like to talk about their health issues. I've heard it before, I've witnessed it. Of course, it doesn't apply to all Black men, but it's worth exploring. And that's why I reached out to someone we know pretty well.
Yes, and I'm guilty of that too. I'm guilty of, I'm fine, I'll be okay.
But Fox 4's chief meteorologist Derek Beasley wants other men, especially Black men, to know that it's not always just fine.
And I think that's probably something that we were taught when we grow up as Black men, is that we have to be able to just deal with things and handle it.
Life, which has included handling the prostate cancer diagnoses of his grandfather and uncle, led Derek to a shift in thinking about his own future and the future of his wife and son.
And so if you're kind of on the fence about, going to the doctor and getting checked out and feel like it's going to be a bit too invasive, by simply getting over that hump, you could end up saving your life and saying you're saving your family a lot of heartache.
A message Barney now shares as a patient advocate for the Prostate Cancer Foundation, spending a lot of time in the community sharing his story, hoping to encourage all men to take health, screening, and treatment options seriously.
It is not a death sentence. You can live a nice, fruitful life. Yes, there's going to be some changes, but it is not a death sentence.
Of course, the topic of healthcare and Black men is complex. Dr. Yamoa, Barney, and another physician that I talked to all offered further insight on that topic, and you can find that on our website. But the thing that they all did agree upon is the importance of getting screened. We've got that information for you on fox4now.com. Shari Armstrong, Fox 4, in your corner.